Question: what's the typical response for a clinician who wants to know more about a colleague's skill level? It's not uncommon to hear a clinician use some version of the phrase, "I would trust her to care for my family." This video was created to introduce you to an interesting way of thinking about both teaching and learning. It's demonstrating something called an entrustable professional activity, or EPA. We will cover what an EPA is, why it's important, and what's involved in using EPAs during a rotation, and what's trust got to do with it. Here's a multiple choice question. What is an EPA? A unit of professional work. B, what's actually done during the clinician's day. C, something that can be assigned, measured, and observed. D, that same something that a supervisor could trust a learner to do independently or unsupervised. E, a way to teach and assess learners. Or F, all of the above. It's no surprise that each of these describes an EPA. Let's review some concrete examples. These are the Foundation's EPAs for psychiatry from the Royal College. 1. Assessing, diagnosing, and participating in the management of patients with medical presentations relevant to psychiatry. 2. Performing psychiatric assessments referencing a biopsychosocial approach and developing basic differential diagnoses for patients with mental disorders. 3. Developing and implementing management plans for patients with psychiatric presentations. 4. Performing risk assessments. 5. Performing critical appraisal and presenting psychiatric literature. Each EPA is a unit of work and outlines something a psychiatrist actually does. You could also imagine your resident being trusted to function independently for each of those activities, and so an EPA is something on which a learner could be both observed and assessed. Why might an EPA be important in the context of teaching and learning? 2 reasons are: 1, confirming progress in performing key tasks of our specialty, and 2, for feedback. First, let's talk about confirming a resident's progress. In Competency by Design, the Royal College branding of competency-based medical education, we want to ensure that each resident can competently perform key tasks. By tracking them, our competency committee will have information to confirm who is making progress as expected and to identify early on if someone needs extra support. Residents are expected to achieve the EPAs by the end of each stage of training, and teachers are to confirm that the EPAs have been achieved. EPAs represent the integration of a large number of competencies into a manageable number of activities for learners. They are made up of component milestones. They enable supervising faculty to meaningfully assess residents in the moment, day to day. Remember the other reason? Feedback. For years, learners have been telling us they want more meaningful feedback. Feedback is one of the most effective ways to support a resident's growth and development. The most specific and meaningful feedback is based on what is directly observed. It is by directly observing an EPA task that you are able to provide the most helpful feedback about it. So what's trust got to do with it? The more a supervisor directly observes a learner, the more likely and easier it is to confirm that he or she trusts the learner to perform an act independently or unsupervised. And so, to bring it back to where I began, shouldn't we all aspire to be and train clinicians our colleagues would trust to take care of their family members?